those calling for an apology today is Nadra Ahmed, the chair of the National Care Association. She joins me now. Thank you very much for joining us this lunchtime. What difference would an apology make from the Prime Minister on this if he changes his mind and does that?
Well, I think what it would do is it would just show that he had meant what we're being told that he meant, and not what he said, because what came out of his mouth is very different to the explanations we're getting about what he meant. So all it needs is for him to come out and talk directly to all the care workers and say that isn't what he meant, this is what he meant. And perhaps we would start to see some reinstatement of confidence in what he's trying to do for the sector, because at this moment in time it feels very much as though what he said is what the thinking around his table is, and that's really quite frightening for our sector at this moment in time.
What is it doing for staff morale, especially any of the workers in the care home sector who at the start of this pandemic didn't have the correct masks, the correct PPE when they were dealing with patients who at the time we didn't know whether they had COVID or not?
Well, these are the people who've come through a living hell during this pandemic. We weren't told what to do at the very beginning. Procedures that were being put out slowly, chaotically, were often changed, advice was different, and it was our staff that were trying to manage the situation, the discharges that were coming out of hospital, the diverted PPE, the lack of testing, and despite it all, we've done the very, very best we can, and the small to medium-sized providers that I represent have invested their time, their energies and their money into making sure these places are safe. And now to be faced...
Nadra, sorry to interrupt you there. I just wanted to also bring in Mark Adams, the Chief Executive of the charity Community Integrated Care. You called the Prime Minister's comments cowardly, and you said there's been a travesty of leadership. Mark, first of all, why cowardly specifically?
I think because if you look at how the social care sector has responded through this crisis, we haven't complained about the lack of testing, the lack of PPE or the lack of funding. We've got on with caring for the people in our charge. And I think by and large, the 1.5 million people in the sector have acquitted themselves fantastically. So to get the leading politician in the country inferring that a large proportion of the people that have sadly lost their lives might in some way be attributed to people not following the procedures is just absolute poppycock. And I think that the Prime Minister does owe an apology because there is a huge amount of anger out there where, having done so much, we get that kind of recognition.
Nadra, the Health Secretary told the Commons earlier that the Prime Minister is certainly not blaming care homes, rather that nobody knew the correct procedures, that what they were because of the extent of the asymptomatic cases, they weren't known at the time. How do you react to that clarification?
Well, it isn't clarification, it's spin, because clearly what the Prime Minister said yesterday was that sadly a lot of the deaths were because a number of care homes hadn't followed the guidance. He didn't say nobody could have followed the guidance because there wasn't any. He didn't say anything about asymptomatic people. He said some of the providers had failed, and that's just simply not true.
Nadra, your reaction to that statement from Matt Hancock?
Well, I think all it is a bit of backtracking, and it just isn't good enough. The asymptomatic argument has been coming into the equation. It's come in lately. At that moment in time, we were working towards what we were being told by government that we had to do. And so we're following procedures.
Sorry, Nadra, just to finish there with Mark, is there enough now known and enough testing, crucially, to stop this happening again? Patients with COVID being moved from hospitals to care homes, if we saw a second wave later on this year in the winter?
I think the government have learnt their lessons on moving people out of acute trusts and into care homes, but I think that PPE is still 90% sourced by the sector. The funding is abysmal, the funding isn't coming through to the sector, and the main issue is the testing. We've finally got confirmation that at some point we're going to move towards weekly testing, which we've been crying out for the last 4 or 5 months. And the reality is we got through the majority of wave 1 without any testing happening in care homes, and by the time it started to come through, many of the people had sadly already lost their lives.
Okay, Mark Adams and Nadra Ahmed, thank you very much for your thoughts on this. Thank you.
Thank you.